Here are 5 mistakes people often make in therapy. Now, starting off with the first most common mistake, checking my notes, is trying to impress your therapist. As a recovering people pleaser and perfectionist, this one's really hard for me. And it's really common for people in therapy to feel like they have to do exactly what their therapist says, and they have to make sure they complete the homework to 100%, even if it's like super triggering, or it's too difficult, or it makes them fall apart in their life in between sessions. Remember that therapy isn't about impressing your therapist. It actually doesn't really matter if your therapist thinks you're doing a great job, as long as they know that you're motivated and you're trying your best. A therapist isn't someone that you have to worry about impressing either, because the dynamic of the relationship is really that they show up for you, hold space in their office for you to dump everything that you need to, and then they help guide you toward your goals. That can mean that we take 2 steps forward, 1 step back, or 1 step forward, 10 steps back. It really just depends on how we're doing. I hear from our community all the time about how you want to be your therapist's favorite patient. And I hate to tell you, but that's really missing the point. And therapists don't really have favorite patients. Overall, the goal of therapy, like I kind of said, is really for us to acknowledge what's going on that we don't like, talk about maybe where we think it comes from or how often we've been doing this, kind of have some insight into our own behaviors, and then work with our therapist toward our goals. So like, let's say the reason I go to therapy is because I have anxiety, and it's making it hard for me to do my job, and it's also making it hard for me to make new friends. Then if I go to therapy and try to impress my therapist, and I don't even let him or her know that like I'm still having panic attacks and the homework is too hard, I'm just doing my best to do everything just so, it's not really gonna help me, right? I'm not gonna end up feeling better. Overall, trying to impress your therapist is a common mistake because it limits what we can get out of therapy. Instead of focusing on ourselves, it focuses on the therapist and their perception of us. And that is going to get in the way. It's kind of like a blocker in between us and the work that we really need to do. Because therapy, remember, is all about us as the patient and not about the therapist. That's why we traditionally shouldn't know that much about our therapist, if anything really at all, because it's not about them, it's about us. Mistake number 2 is expecting quick fixes. Now, I agree. As a therapist, I wish a patient could come in to see me and in 5 or 6 sessions, presto fixo, they feel better and everything is improved. But unfortunately, the types of things that we're working on in therapy, like changing our behaviors, identifying our feelings, improving our communication skills, improving our relationships, right? All of the things that we're trying to work on took a long time to develop. Like, I'm a recovering people pleaser, like I said. This stems from things in my childhood, like my dad working away from home a lot. So I had this like scarcity mindset with him where I thought, oh, if I did everything just right, if I just made him happier to see me or more proud of me, then he'll come home more often, right? It was like childlike thinking. That started when I, like before I remember, like 5 years old, 6 years old, like when I'm first forming long-term memory. I've been doing this for a long time. So I'm 41. You do the math. I can't expect to go to therapy for 5 or 6 or 7 sessions and magically feel better. It's going to take time for me to understand, where it started and where it comes from and how I can change it. Because that's been the biggest thing for me in my own therapeutic work, is understanding the how of it. Okay, so it comes from my past and my dad and the scarcity mindset. Okay, well then how did it turn into this? And then how can I choose to act differently? And those are really those 2 big steps in therapy that I have to take, and I have to try, not saying sorry so much. I have to say no when I mean to, and practice setting and upholding boundaries. And all of that takes work and unfortunately takes time. We can't expect to know everything about it, have all this insight, and be able to change overnight. Be patient with yourself, because if we try to rush it, we can overlook important pieces. We can also re-traumatize ourselves, or maybe even make something worse on accident. So if you feel like, oh, therapy should be going faster, things should be moving more quickly, take a beat. Give yourself some compassion, and remember, it took us many years to develop this type of belief system or this behavior. It's going to take us a little bit to work through it. And that's why treatment plans can be incredibly helpful if you are with a therapist and you feel like, I don't really know where this is going, or I don't feel like I'm achieving any goals that I want. Am I getting any better? It can feel like we're wasting our time, right? If you start to feel that way, ask your therapist. Say, hey, I'm feeling kind of like things aren't moving at a pace that I'd like, and I don't know if I'm making the progress that I should be. Could we put together a treatment plan? Every therapist worth their salt has put together treatment plans, at the very least in their training when they were first starting. It's essentially your long-term goals, mid-term goals, and short-term goals. They help you come up with those, figure out what those are, and then we work backwards from them so that we know we're making progress. We can reference it. It's like a living, breathing document. I can be like, look, we've made progress on this goal to say no to our mother more. We've also made an improvement on this goal in communicating more clearly with our best friend, right? So we can see where we're at, and it also shows us we're making progress. If by random happenstance your therapist is like, well, I don't do those, what you can ask is, hey, could you read me some of your notes from like 6 months ago? You will be surprised how far you've come. That's also why I love journaling. You can do this on your own. If you're journaling about what's bothering you and what you're going through, you can read back last month, 6 months, a year ago, and you can see how far you've come, how maybe much better you're managing that upset, or how you're more often using those skills that your therapist taught you so that you don't blow up on those you love, or whatever it might be. You'll be able to see that progress and track it. And that can be really powerful, especially if we're feeling kind of stagnant, like we're not moving forward. Hopefully that helps keep you motivated, because unfortunately, therapy is not a quick fix. Mistake number 3 is avoiding topics and not being direct. Now, what I mean by this is when we go into therapy, the goal is for us to speak the truth, to share what's happening in our life and what's bothering us, and then have our therapist help us, right? Like put together that treatment plan, tell us what we can work on, and offer tools and resources. If we avoid certain topics, or if we beat around the bush, that's going to make it take longer. We could send a therapist off on a wild goose chase. I had a patient, this is, I don't even know how many years ago now, who would lie to me a lot about a specific eating behavior. Now, if you guys don't know, I specialize in the treatment of eating disorders and self-injury. Now, this patient was supposed to be following this meal plan and claimed that they really were, but they were lying about their late night eating and certain rituals they had around it. And so I didn't know that was a problem. I didn't know that was something that they needed assistance with, maybe more structure, routines. They also lived at home still, so we could get some parental support in there as they were very active. I didn't know, so this went on for probably a good 6 months to a year, longer than it should have. And that also meant that I didn't understand why things weren't progressing in the ways that I thought, and we were having these slip-ups that didn't really track with what I thought was going on. And so if we avoid talking about the uncomfortable thing, or if we aren't direct and we kind of beat around the bush, we're only going to slow our own therapy down. And yes, I know, if we have trauma in our past or any kind of abuse, or even personally, there are things that I avoid talking about in therapy for a while because I'm uncomfortable with how it sounds, right? I don't like to say it. Ugh. But the longer we put it off, the longer it takes for our therapist to be able to help us, because they can't help what they don't know. And that doesn't mean that you have to go in and like verbal diarrhea everything. I usually do that, but you can take it at your own pace. I just want you to know that if you avoid topics, like if you're like, I really have an issue with my dad, but it's just not appropriate for me to talk about him with a stranger, and you never bring that up, well, then that part of your life or that relationship will never improve, or the issues that you have will never get addressed. And so make sure that when you're in therapy, you give yourself time, you give yourself an opportunity to slowly bring up those difficult topics, to be as direct as you can about it. And that will allow your therapist to help you in the places where you need it most. And if this is incredibly difficult for you and you're like, Katie, there's no way I could ever say that out loud, horror of all horrors, journal about it. And maybe even ask your therapist, hey, could I send you like short emails? They can have character limits. Therapists can be very boundaried, which I totally respect. But ask, could I send you like a short paragraph about something, I struggle to bring it up in session, I'd like to let you know. Ask them about that. Could I text you about something? Could I give you an entry from my journal? I had a patient once copy a whole bunch of entries from her journal, and she was like, you can read these during our time. I just need you to know about it. There are a ton of ways to get around it. So if you find yourself not talking about things or being really indirect about a big issue in your life, maybe try one of those ways to kind of get it in so that we can ensure you're getting the support where you need it most. Mistake number 4 is thinking that your therapist is always right. I know, this one probably comes as a shock, but therapists aren't gods. We're humans just like you, right? We make mistakes. We might make assumptions. We have our own experience in our life with our patients, our own like career-based experience. We have our own values and beliefs. And if we don't keep our own stuff in check, sometimes that can come out. And again, we're not perfect, right? I've been in and out of my own therapy since I was 15, and I still feel the urge to go back frequently because I still need support and I still need someone to like call me on my shit. And so I'm not perfect. I will mess up. I will say something that doesn't align. I might say, you seem so angry. And you're like, oh my God, am I angry? I don't think I'm angry. Oh, and I could spin you out because I made a poor assumption, or I thought that that meant that when it didn't, right? I can make connections where they don't exist. And so I want you to know that it is completely okay and healthy to challenge what your therapist says if you don't agree. Like I've told you guys for years, if you get a new diagnosis, let's say they believe that you have, I don't know, anxiety, of generalized anxiety disorder, and you don't think that's what it is, you think it's depression, it's okay to say that. To say, that doesn't really align. I don't feel like what I'm struggling with is anxiety. I don't feel worried. I feel lethargic and sad, and maybe I'm misrepresenting it. Or maybe you're seeing symptoms that I'm not aware of, because truly it should be a dialogue between you and your therapist. It's not therapist knows best always is correct and you as patient don't know best and are never correct. You are the expert in your own experience. And that's why I used to say back in the day, I was like, with your experience and my expertise, we work together towards a healthy mind and a healthy body. Because that's true. That's how it should be. So don't think that your therapist always is correct. It's okay to challenge them. It's okay to ask clarifying questions. It's also okay to say, I don't think that's it. Where else could it come from? That just doesn't ring true to me, right? That's why whenever I'm answering questions on the podcast or even doing videos, I'm always like, does that make sense? Does you follow that? Are you picking up what I'm putting down? Because I want to make sure we're on the same page. And that piece is really vital in therapy because that will ensure that you get the right support you need and it's on the issues that are actually bothering you. Oh, also, I just wanted to mention that just because your therapist is wrong from time to time does not mean you need a new therapist. The sign that you would need a new therapist is if you feel like they never understand what you're saying and they don't remember important things and they're always like way off base. You're like, that's not at all what I was talking about. If you don't feel heard, seen, and understood by your therapist, then you might need a new one. But a therapist getting something wrong or like you disagreeing, that's just part of the dynamic. That's like building that therapeutic relationship, which can be so incredibly helpful when it's, created over time and created with helpful dialogue, a little bit of maybe disagreement here and there. I feel like that's all part of the process. Mistake number 5 is keeping therapy in therapy. Is that right? Yeah, okay. I hear from people all the time that like therapy is the thing that's going to fix me. It's going to help me and it's going to be the place I go to do all this work. Yes and no. We're going to go into therapy to gather insight, to be challenged on the ways that we think and act in our life that aren't doing us any favors. But the real work is going to happen when we leave the office. That's why I'm such a firm believer in homework and journaling and stuff like that, because that's where we do the things that we're learning in therapy, meaning that's where I challenge myself to set a boundary, to say no and mean it, to not apologize so much, or to communicate more clearly and not pufferfish people. That's where I do that, is outside of therapy. So the real work doesn't happen in therapy. It happens outside of it. And sure, I know some of you are like, but I've done like EMDR or other trauma-based ones, and there's a lot of work that goes on in therapy. I'm not saying work doesn't happen there, but I'm saying the real challenge or the real work happens outside of therapy. We don't want to keep therapy in therapy. We want it to improve our entire life. And so the sooner we realize that the things that we learn about in therapy and the challenges our therapist gives us and all of the stuff that happens there that is so maybe like mind-blowing, like, and also like, ooh, I don't know if I can talk about this. All that stuff that happens is great and beautiful, and it should be happening in therapy. But then what do we do for the other, I don't know how many hours there are in a week, but if we're only in therapy once a week for an hour, the rest of the hours of our week need to be applying that to our life so that the things that were bothering us, that brought us into therapy, stop bothering us. And I know it's hard, trust me. It's the hard part. But I want you to know that therapy shouldn't only be happening in therapy. That will really just slow our progress and not really help us at all. We can gain a lot of insight. We can learn about the whys behind things, but we don't really know how to do better. And the whole goal of therapy is to get us to apply it to our life. So essentially we don't really need therapy anymore. We kind of pop in and out as we need like checkups, but we're doing okay. So make sure you don't keep therapy in therapy. Okay, conclusion. Therapy can be such an incredibly healing process. I personally have found it life-changing. There are things about myself in my 20s and even in my teens I'm like ashamed to admit I was even dealing with. But therapy allowed me to acknowledge what was happening, figure out where it was coming from, and choose to act differently. So I want you to know that therapy can be a completely life-changing experience. But we have to be honest. We have to apply what we're learning in therapy to our life. We have to challenge our therapist when we think they need to be challenged. And we have to talk about the things that, truth be told, we don't want to talk about. All of that is going to ensure that we get the most out of it. And know that it's okay to take time finding the right fit. I have old videos about, what makes a bad therapist, what makes a good therapist. You can watch those. I'll link those in the description. So you can check those out if you're looking for a little bit more guidance. But overall, know that your therapist should feel like that tough love friend. The one that you feel pretty comfortable talking to. Still a little like, oh, this thing's kind of vulnerable for me. But we do it anyways. And they allow us to see things from a different perspective, and they challenge us to be better. That's how we should feel. It's not always the most comfortable, but we feel like we can talk to them. We get kind of that like, I like them. I don't know why, but I like them, right? They should feel like a friend that we don't know anything about, right? It's kind of a weird dynamic, but know that therapy can be life-changing if we truly apply it. And I encourage you, if anybody out there is thinking like, I don't know, like, do I really need therapy? I'm doing okay. Everyone can benefit from therapy. It allows us to see the issues that we're having, the symptoms cropping up, the anxiety we're feeling. It allows us to acknowledge that and find better ways to act so that we can improve our lives, so that we don't feel so held back by our depression, our anxiety, our stress level, our people-pleasing behaviors, our hyper-independence, or whatever it is we're going through. So I can't encourage you enough to check out therapy in your area and make sure it's a good fit. And hopefully this helps you avoid some common mistakes. If there are others that you think I forgot, leave them in the comments down below. Have a wonderful week. I'll see you next time. I have to get the iPad and I'll do the shorts. How long was that?